Emergency abortions are no longer required at hospitals nationwide. That's because the Trump administration just revoked a Biden policy that ordered virtually all hospitals nationwide to provide those emergency abortions when they are medically necessary to stabilize a woman's medical condition. Obviously, this move is extremely concerning to pregnant women, especially in states with strict abortion bans. Now, yesterday, the Department of Health and Human Services issued this one-paragraph statement saying it was rescinding the guidance and attached letter distributed to all hospitals that receive money from the federal government, which is like all of them, from July of 2022. Now, if you want to read all of this, I'm going to email it all out to you in my Facts HQ email, so make sure you sign yourself up. So this all has to do with two things. One, the Supreme Court overturning Roe versus Wade, which has led to multiple states passing strict or near full abortion bans. And two, the EMTALA law. Now, back in 2022, when the Supreme Court threw out 50 years of precedent that constitutionally protected abortions nationwide, that opened the door for lots of states to enact strict or near total abortion bans. And because that federal protection from Roe was gone, there was nothing the federal government could do to stop those bans or restrictions in the states. Enter EMTALA. EMTALA is the Emergency Medical Treatment and Active Labor Act. That law was passed in 1986, and it requires all hospitals that receive Medicare funding, again, which is like all of them, to provide patients with appropriate medical screening, examination, stabilization, treatment, and transfer if necessary. The physician or qualified medical professional has a legal duty under EMTALA to provide stabilizing medical treatment to a patient who presents with an emergency. Well, in July of 2022, the Biden administration issued a new policy, which they called guidance, to expand the interpretation of what was considered stabilizing medical treatment under EMTALA. The Biden guidance said emergency abortions qualified as stabilizing medical treatment, and it included, but was not limited to, ectopic pregnancy, complications from pregnancy loss, and emergent hypertensive disorders like preeclampsia. And all doctors in all hospitals in all states that receive Medicare funding had to comply if it was medically necessary, regardless of what the state abortion law said. Of course, states with strict abortion laws sued, and in 2024, the Supreme Court basically sidestepped the issue, and in the end, that sidestepping allowed the Biden administration to continue with its interpretation and did allow that interpretation to overrule any state abortion law. Well, now President Trump is in office, and obviously things have changed. Remember, including abortions as stabilizing medical treatment was just an interpretation of EMTALA by the Biden administration. That interpretation was never codified into law. It was just guidance related to EMTALA. And now the Trump administration has a different interpretation of EMTALA. The Trump administration did not come out in this new statement and blatantly say abortions are no longer considered a stabilizing medical treatment under EMTALA anymore. That's not what the statement said. What it said was the Trump administration would continue to enforce EMTALA, which protects all individuals who present to a hospital emergency department seeking examination or treatment, including for identified emergency medical conditions that place the health of a pregnant woman or her unborn child in serious jeopardy. CMS will work to rectify any perceived legal confusion and instability created by the former administration's actions. So what does that mean? Well, the statement clearly does not say that abortions are a required option for emergency treatment. It says CMS will rectify any perceived legal confusion from the Biden administration's interpretation. Now, based on what we know about the Trump administration's stance on all this, that means while they will still enforce the original interpretation of EMTALA, the abortion laws in each state, whatever they are, will probably be what is enforced first.